If we look at the population figures in 2019, estimates are that our population is rising very quickly. And at the current rate, with a very, very low contraceptive prevalence rate in Nigeria, we are going to be the third most populous country after the US by 2050. And I'm sure all of you can just imagine the land area of Nigeria. It's not getting any bigger. And our economic has slowed down significantly, with COVID-19 further exacerbating some of the economic challenges we have in the country. If we extrapolate that and now look at our population growth rates, we realize that we are going to have a significant challenge. We've seen a lot of insecurity in Nigeria in the last few years. This cannot be separated from our rising population. Why? Because our average age in Nigeria is about 18. And with such a huge youth population, there is a greater demand on accessible opportunities for employment, education, and healthcare is not left out. So if we look at the number of children that an average Nigerian woman has, an average Nigerian has about 5 children. Some may say that cultural dimensions lead and enable these high population growth rates to continue. But at the current rate of about 5 children for every Nigerian woman, our population will no longer be able to sustain the current future generations, who we hope will be productive members of our society. So that is why, such editorial roundtables are very, very important, because we need to keep on writing, we need to keep on informing Nigerians about the importance of access to sexual reproductive health products and services. Without that, I think there will be this continued lack of knowledge of why we have to raise these issues. So I think the focus today really is on 2 principal things. First of all, finance. To enable every single state in Nigeria to be able to provide their citizens with the commodities, services they need for women to have access to sexual reproductive health rights services, there needs to be funding at the state level. I think we know that some of our state officials are not fully on board about the importance of ensuring that there is a dedicated line item in every single state for family planning commodities and services. So this is where you come in. We need to keep on explaining, we need to keep on writing about these issues. And the next point, of course, is actual access. So what are the current barriers to this editorial roundtable? And through this, inform some of the information we share, inform our issue, and more important, health challenges in Nigeria. How do we keep this issue top of mind? How do we keep this in people's consciousness? How do we make sure that Nigerians are well informed about the importance of not just ensuring that there's access to funds in every state for family planning services and commodities, but also ensuring that women who need it, women and girls who need these services, have access to it. The Department for International Development, now FCDO, recently reduced funding to Nigeria and to many developing countries for family planning services. This heightens the need for domestic resource mobilization for all these services at state level. And so at every state, we need to ensure through our advocacy, through the work that you do in the media, that these issues, again, stay top of mind. So I think with these things to lead us in our discussions today, I hope this will be the platform that we use to ensure that we share learnings with everybody today. We're able to have an open discussion where there are gaps in people's knowledge or access to information. We may address this. We're very fortunate to have some quite experienced journalists who've written and shared information about this issue from other African countries. So we hope that you use the platform to share insights and to network with each other so that we continue to have these discussions and ensure that they stay top of mind. So without further ado, Editorial Roundtable. Thank you very much, everybody. Over.
Thank you very much, Vivian, for setting the tone for the editorial roundtable. My name is Dara Ajaladam. It's great to have everyone here. I'm program manager at Nigeria Health Watch as well. We don't have a lot of time, but we are very grateful for all of our distinguished participants and speakers who have joined on today. I think Vivian had done an excellent job really setting the tone for our conversations today. Three key things that I take away from that: what kinds of role will the media play in, increasing financing and access, as well as information for SRHR services to participants, people who need it the most. Great. So it's my honor to introduce Beatrice Padassini, who will be giving a very brief goodwill remark. Beatrice is, a communicator, which is a strategic communicator and a freelance journalist, and she's also health manager at Internews, who we have partnered with, who thankfully we partnered with to deliver this editorial roundtable today. So over to you, Beatrice.
Thank you so much, Dara. Thank you so much. I appreciate it, and welcome everyone. It is very much a pleasure to be here today, and we are delighted to be partnering with the Nigeria Health Watch for this editorial roundtable on SRHR, sexual reproductive health and rights. It's such an important issue. I am based in the U.S. and I'm originally from Italy. And as you know, right now in the United States, there's a lot of things happening when it comes to sexual and reproductive health, and some setbacks for a lot of women and young girls. So it's a very important issue, not just in Nigeria, but all over the world. So just a few words about the Health Journalism Network. This network was started in October 2020, and it encompasses more than 1,200 health professionals, journalists, and media professionals from about 85 countries. Our network has three main objectives, really: to build community, to build capacity, and to improve the quality of health reporting worldwide. So we are very happy to be focusing on sexual reproductive health and rights, because this is the first time that we really, even though we're still amid the pandemic, COVID-19, that we can focus also on other issues that are being affected by COVID right now. So without any further ado, I'd give the word back to Dara to dive into these topics. Over to you, Dara. Thank you.
Thank you so much, Beatrice. And again, excited to be partnering with you. Okay, great. I have just received word that our next speaker is here. This is an editorial roundtable, which means that a lot of the conversations, it's an experience sharing event. A lot of the conversations will pull insights from everyone present. But to further give critical insights into the SRHR space, we are excited to have speak to us for a few minutes, Abena, who is an experienced development and management expert with expertise in design and management of programs across education, community development. Abena has over 15 years of direct management experience, that is with implementing successful programs in most of the regions of Ghana, where she demonstrated continuous professional excellence, proven leadership, and as well as management abilities. So to take us further into this roundtable, I'm happy to invite Abena Adubea-Amor, who is the Executive Director, Planned Parenthood Association of Ghana. She's going to talk around improving access to SRHR in Ghana. What are some of the challenges and the opportunities from the PPAG experience? Excited to have you here, Abena, and over to you.
Thank you very much, and a very good morning to you all. I know it's afternoon in Nigeria, but then it's still morning in Ghana. So good morning from Ghana to all of you. And I'm very, very excited to be with you this morning to share our experience from your neighbors, very, very good neighbors at that. And so I work with the Planned Parenthood Association of Ghana. PPAG has been in existence for the past 54 years, working to support government in providing information and services on sexual and reproductive health and rights to Ghanaians. And we work particularly with young people and for young people and also for women as well. When PPAG was set up in 1967, the primary objective was to provide information on family planning and also provide services on family planning. But as the year went by and we began seeing the turn of the millennia and the issues that came with young people, the youth bulge and all that, PPAG reorganized itself and now focuses on young people. And so when you come to our office and also in terms of the programs that we do, we work with young people and we work for young people and ensuring that we provide safe spaces for young people to be able to discuss issues of that affect their lives, particularly issues of sexual and reproductive health and rights, and also to be able to access reproductive health services, without any stigma or without any issues at all. We have about 10 facilities across the country where we provide services to both young people and also to women as well. We have clubs, young and wise clubs in schools and out of school, where we train young people on reproductive health education. And also we train service providers on youth-friendly services as well, so that they can provide their services. We also work with journalists, and that's why I'm very excited to be here today, because we work with the journalists, providing training and support also to journalists to be able to understand issues of sexual and reproductive health and rights, particularly when it has to do with young people and also women, and the fact that women have autonomy over their bodies, and that women have the right to determine what happens to their bodies and so on. And so we provide training and support to journalists to be able to report, accurately issues of sexual and reproductive health and rights, and also understand the issues so that when we are having discussions as far as development is concerned, we can be able to have it together with issues that has to do with sexual and reproductive health. So that being said, I would like to go into my presentation. I'm very sorry I couldn't do a PowerPoint. And so you have to forgive me, but I have some notes that I will try to refer to and provide some very good exposure on Ghana. So Ghana has made a lot of strides. We have made a lot of positive impact as far as sexual and reproductive health and rights are concerned. And so, for instance, since the 1990s, we have been working to ensure that maternal mortality comes to the barest minimum. So from a high of 760 per 100,000 beds. Sorry. I'm very sorry. I forgot to mute my phone. Yeah. So as I was saying, from a high of 760 per 100,000 beds in 1990, we came to 319 in 2014. And so it means that out of every 100,000 live deaths that we record in Ghana, unfortunately, we lose 319 of our women, and that was up to as of 2015. I don't have the current figures yet, but I'm sure that it might come down a little bit because there has been a lot of movement as far as providing access to maternal to mothers or pregnant mothers. We have increased, for instance, the attendance, professional attendance to birth For instance, in Ghana, we have also increased our healthcare services, and we have provided what we call community-based services, which is called the CHIP compounds, that are in most rural communities in Ghana, where midwives are stationed to be able to provide maternal health, antenatal and maternal health care to our mothers. And so we are making a lot of progress in that regard. Also, in terms of total fertility, as at the last count of total fertility, we were at 4.2. The last one was in 2014, and I think 1988 we were at 6.4. But as of 2014, we had come down to 4.2. That also, tells you that there are a lot of work that has gone on as far as family planning and improving contraceptive access. Has also yielded a lot of results as well. We also continue to record higher numbers of married women, especially married women using contraceptives as well in the country. So for instance, at the last count, we had 16% of our women who are married and who are who are not using contraceptives. So we have more women now using contraceptives. And so it has also reduced the total fertility. And at the last population census, the figures that have come out meant that our population rate has also slowed down. The growth rate of population has also slowed down considerably. Now we currently are at 2.1% of population growth. And so that is quite remarkable for a country like ours. But we still continue to face a lot of challenges. So for instance, we have challenges of increasing rate of teenage pregnancies. Last year, COVID exacerbated this situation. And so we recorded over 130,000 teenage pregnancies across the country. And these are figures from the Ministry of Health. So these are young girls who have gone for antenatal checks in our various health facilities and who have been recorded. And if you are very familiar with Africa, I'm sure Ghana is not different from Nigeria. There are many more young people who would feel stigmatized to access healthcare. For instance, especially when they are pregnant. And so you have many more of them not accessing healthcare at all, who might be pregnant and who might be in our homes and in our communities who will not go to access healthcare. And so our estimation is that there might be more of these young girls who have found themselves pregnant last year alone. And for the past 5 years, it's going into more than 500,000 young girls who have gotten pregnant and who are between the ages of 10 and 19. And so that is quite worrying for us in the sector, providing access for people for as far as sexual and reproductive health is concerned. And then also there is also the lack of adequate budget, both from the donor side, but also from government side. So for instance, our government, the government has not been able to reach its commitment towards healthcare. And so the government committed to use a percentage of 5% of GDP towards healthcare. But as of last year, which is 2020, it was hovering around 3.5%. And out of the 3.5% that was towards healthcare, over 70% of this amount of money goes into compensation, which means that 30% is left for infrastructure and provision of commodities and drugs. Only 10% goes to commodities and drugs. Currently, more than 80% of the family planning or contraceptive use, contraceptives that Ghana receives or that the country uses or the citizen uses, come from donors. So you have donors like UNFPA, USAID, West Africa Health Organization, and others supporting the delivery of contraception in Ghana. And so inadequate funding and budget continues to be the challenge for us. And so we continue to ask ourselves, if the donors pull out, so for instance, this year alone, the UK has cut its budget health budget, international aid budget by over 70%, which has affected UNFPA in terms of the delivery of commodities to third world countries like Ghana. And so there is shortage as far as UNFPA's supply is concerned. What is going to happen to us in the year 2022 as far as family planning is concerned? And so that continues to be a challenge for us as CSOs. And then also, I mean, a lot of donors, traditional donors, also moving away from the provision of donor funding towards social services. So for instance, towards services like education and health. And so the sexual and reproductive health sector has been high hit by this. And so you get a lot of the donors moving into, so for instance, youth employment and moving into livelihood development and other sectors, and not necessarily sexual and reproductive. So that continues to be a problem for us, which is lack of funding. And then we still continue to see a lot of opposition to sexual and reproductive health and rights issues in the country. Opposition from community leaders, opposition from religious leaders, Christendom from the Islamic religion, and opposition from traditionalists, as far as sexual and reproductive health, education and service is concerned, particularly when it comes to young people. And so you have young people who might have the knowledge, a lot of them don't have the knowledge. We still have quite a number of them who do not have the knowledge about sexual and reproductive health, about contraception, about the use of condoms, about SGBV and its related issues, and how to stay, how to report and all that. But then, even for those who have, access still continues to be a problem. Stigma continues to be a problem. Issues of unsafe abortion continues to be a problem because of the lack of access. Young people cannot get up and go to our clinics, for instance, to demand for comprehensive abortion care. Although the laws in Ghana, the protocols in Ghana allows young people or women to be able to access abortion, comprehensive abortion care, if it has a physical or emotional liability as far as the women are concerned. But because of issues of stigma,
sorry, Abena, I'm having trouble hearing you. Just want to flag that. Is anyone else having?
Yeah, I'm having challenges hearing Abena as well. We'll just give it.
Internet coming and going.
Please give me a minute. Let me see. Hello, is it better now?
Yes.
Yes, it's better. Thank you.
Thank you.
Is it better? Okay. I had to switch. Yeah, okay, so I hope it's better. So yeah, so I was just talking about issues of stigma and the fact that stigma does not allow young people to have access to sexual and reproductive health information and services. And also, we also have the issue of increased rates of sexual and gender-based violence as well. COVID has come to bring out a lot of issues that were really, they existed, but I think COVID has exacerbated it. So for instance, the lockdown period, the long lockdown period that we experienced as far as young people are concerned, a lot of young people were at home who were supposed to be in school, but they had to stay at home for almost a year because of COVID. And we recorded a lot of sexual and gender-based violence. And so we are worried that this is increasing in the country. And unfortunately, there's a lot of misinformation, there's a lot of stigma around sexual and gender-based violence. There's a lot of victim blaming around this. And so someone reports it and they are the ones that are being blamed. What did you go to do in the man's room? What were you wearing? How did it happen to you? Why not your friend? And so all these continue to have effect on young people and also on women. And the statistics shows that a lot of women, I think about 11% of women between the ages of 16, currently of 16 and 49, have experienced some form of sexual violence. And also 6% of men or boys have also experienced some form of sexual and gender-based violence in the country. And so this continues to be a challenge for us as well. And then one other issue that I want to mention is also the issue of the media reportage. There's been a lot of sensitization. I must commend the media that they've done a lot. We've done a lot of work with the media, especially in sensitizing them on reporting on issues of sexual and gender-based violence. But there's still a lot to be done. How reports are done in Ghana sort of victimizes the victim and puts the victim in a light and in not so good or a negative light. And so that's also still something that we are working on as far as the media is concerned. And also, PPAD, we've been working with media people, training and providing support for them, but there's still a huge number of media houses, media personnel who, some of them do not even, they are not interested in issues of sexual and sexual and reproductive health. Private matters, and so it must be dealt privately. And so you don't need to talk about it in public. And so there's been a lot of conversation going around. There's been a lot of training. There's been a lot of values clarification for media personnel and also opinion leaders across the country on issues of sexual and reproductive health, education and rights, just so that people will understand that issues of sexual reproductive health is a public issue. It's an issue that concerns everybody. Although sexual act, we all see the effect of it in public. And so there's no need hiding to talk about it. There's no need to hide the issues. We need to talk about it. And if we can have a very healthy population and to be able to develop our countries, it means that we must have a very healthy population who have knowledge of sexual rights, who have knowledge of their reproductive system and how to stay healthy, and who have autonomy over their bodies and what to do and what not to do, and to be able to take responsibilities for what they do. And so it's something that we need to talk about. And we continue to discuss this in the media space. We continue to talk about this with our media, with our friends from the media, with opinion leaders, with a lot of our opinion leaders, religious leaders, so that we can have the safe space to be able to work. Unfortunately, one of the challenges we continue to also have is the shrinking civil space in the country. I think that the collaboration between government or the public sector and the private sector is shrinking. And there's not a lot of spaces that the private sector is able to partner with government to be able to provide this information and services to our young people and also to the population. And so that's also one of the challenges that we are seeing. We've been working with so for instance, UNFPA, UNICEF, and other international organizations to be able to open the spaces for civil society to be able to dialogue with government. It's been difficult, but then we keep pushing to see how this can work for us. And so these are some of the challenges that we have in the space in Ghana. But opportunities, a lot of opportunities abound for us. One is technology. Now a lot of people are using mobile phones. A lot of us are using Android phones. A lot of us are educated. And so we are able to read and to write and to understand issues. And so it's getting a bit easier to carry messages across. And so PPAD, for instance, we've been doing a lot of media engagement We've been doing a lot of advocacy in the media space, in social media. So for instance, on Facebook, on Twitter, on LinkedIn, and on other social media spaces. We've been doing a lot of education, and a lot of young people are joining. We are even doing reproductive health education on WhatsApp. I mean, we create WhatsApp pages. We have our peer educators go on there and provide education for them. And so that is an opportunity that we have that we continue to explore. Also, we, in the spirit of digital health, we also have a contact, an ultra-modern contact center, where we are able to reach millions of people with information and services on reproductive health. And people can call our center toll-free. You don't have to pay anything, and ask any question, discuss any issues they have. We are able to provide referrals to clinics and to counseling, and both medical counseling and psychological counseling as well to our clients. Just last year, between June and this time, we've provided more than 2 million services via our digital health platform to Ghanaians, which is a very big plus for us. So we think that technology provides a huge opportunity for us to be able to provide this. And also we are using the traditional media as well. So we are still using the news portals that we have around. We have journalist friends who develop blogs for us, who write blogs and about sexual and reproductive health issues, and provide education in the traditional media as well for us, which is a very huge advantage as well. And then in terms of the donors, we still are seeing some new donors that are coming in. We are losing a lot of them, but we still are finding a lot more donors, non-traditional donors, so foundations and others that are coming in to provide support to us, for us to be able to do the work that we do, and we really, really appreciate that as well. And I think also that COVID-19 came in to cause us a lot of trouble, but then also it provided us with an opportunity to prioritize on health as well. I think every country is now prioritizing health, and the fact that health is wealth. And so through COVID-19, we have also been able to work to provide a lot of education to people on both COVID-19, but also on sexual and reproductive health as well. And so we continue to push the frontiers, we continue to push the agenda on sexual and reproductive health and rights in Ghana. And we hope that in the near future, we'll be able to institutionalize reproductive health education in Ghana, because that is our ultimate aim. Because if young people can take hold of their lives and will be able to grow up into responsible adults and to be able to contribute their quota to the development of the country, so that the country can reap the demographic dividend that has to come with the current budget that we have, then we need to provide reproductive health education to them. And so we are still working with government to be able to provide this across the curriculum in our secondary schools, and also to be able to have guidelines to provide this information also to young people who are out of school as well. So thank you very much. I think that I'll pause here, and then if there are any questions, then I'll take them up. Thank you.
Thank you so much, Habina. Thank you for sharing your insights. It's really, really educative, and just getting a lot of what is the policy and partner landscape for SRHR services, as well as the successes. It's really great to know that, Ghana has been able to achieve as much as, well, the goal is that no woman dies while giving life, but, moving from 760 to 390 is growth, while we still push for, that no woman dies while giving life. Before we go on, we are at the point where experience sharing really starts. So Abina has shared what are some of the successes as well as challenges, accessing SRHR in Ghana. So for our delegates on, a lot of the journalists, the floor is now open. What questions do you have for Abina? I have some questions, but I would like for if any of the participants to go on first. If you have your questions ready, so just indicate with the raise of a hand, and then we'll call you to jump off mic. Okay, so it could be a question, it could be sharing based on what Abina has shared. What is the landscape for SRHR in your country? What is the landscape for media reportage on SRHR in your country? Okay. So while we, Rona has a question. Hi, Rona.
Hello. It's great to be here. So what I wanted to ask, when Abina was speaking, I was quite taken by the fact that funding has reduced by, she said 70%, and also by the fact that the very nature of sexual health and reproduction is very sensitive, and a lot of our communities are conservative. So from their experience, I have two questions. How should we be looking at funding reports sustainably if we don't have all this funding that used to come in before? What ideas have helped Abina and her team reduce reporting costs is what I want to hear. Any ideas to help us reduce reporting costs? And then secondly, how do they negotiate the sensitivity that comes with this type of reporting? Thank you.
Thank you so much, Rona. I will take a few more questions. Adebayo, I see your hands raised.
Yes, good morning, everyone.
Good morning.
My question to Abina is this. I found it quite interesting, and the stride that has been taken in trying to let the, should I say girl child now, or the woman who is giving life, not to die while giving life. But looking at it fundamentally speaking, if you look around in secondary schools, in places where there are gatherings, you see free condom being donated freely, but hardly will you ever see people donate pad, sanitary pad. For all ladies, is there no kind of projects focused towards addressing that issue? Thank you.
Thank you so much, Adebayo. Abina, do you want to take those two questions first? Okay.
Sure. Yeah, so thank you very much. I'll start from Adebayo's because that's so much of an interest to me in Ghana, and to PPAG as well. Yeah, so the issue of the sanitary pads, in fact, it's one of the challenges that I penciled down, but because of lack of time, I couldn't mention it. You know, in Ghana, sanitary pad is classified as a luxury tax, as a luxury item. So it's actually charged an extra 15% tax when it's being imported. Unfortunately, we don't have a locally manufactured sanitary pad in Ghana. We used to have one, but then the company collapsed. And so currently we import almost all the sanitary pads that are used, especially the reusable sanitary pads. But then there's a 15% luxury tax on it. And that's one of the advocacy items that PPAG has currently that we are working with the government on. The current government during the 2020 elections put it in their manifesto that they were going to remove the tax from the pad. And so we are holding them to their promise and we are working on that, yeah. And so in terms of provision of sanitary pads, it's also one of the things that we provide as CSOs. But as I was telling you, once funding becomes a challenge, then providing some of these things also become a challenge. In one of our projects that is sponsored by UNFP, we provide sanitary pads for young people who are in school. so that they are able to continue to go to school and not to miss classes when they are in that part of the month as well. And so wherever we have the opportunity, we do provide. The only challenge is the lack of funding support that we don't have currently. And so it's one of the issues that we are still working on with government on, to see whether this is something that can be provided as well. And so we continue to work on it. In terms of ideas in reducing reporting costs, so currently PPAG, what we have some journalists that we work with, we have trained. In fact, we have provided training and capacity building for these journalists, and so whenever we have some news items, or once in a while they do features for us, and we don't have to pay for them, and that is one of the ways that we have been able to reduce the cost. And then also social media has also come to help us. It's not too expensive to use social media, but then depending on your reach and also the following you have, you are able to review, you are able to provide more leverage on this to be able to report on the issues and also provide education as well. And so those are some of the ways that we have been able to reduce the cost of reporting in Ghana. It is not gone totally. We still have to pay. And we also understand the fact that a lot of the journalists also need to be able to put money and body and soul together. And so we are not complaining so much, but then, we try to support each other and to work things out so that we all can coexist and to make things happen for us. In terms of reducing sensitivity of the issues, in fact, education, that is what we do. We provide education from members of parliament. So for instance, over the years, we've had a very close working relationship with the Population and Health Caucus of Parliament. And also some traditional leaders, religious leaders, and others. We work with them to be able to sensitize them on issues like this. And also on issues that we know are so sensitive that you cannot even mention. So for instance, comprehensive abortion care is something that is very, very sensitive. And although in private, a lot of them understand that these are issues and these are challenges for young people and for women that we need to talk about, a lot of them do not want to say it in the open, or will not want to agree with you in the open. And so what we have done is to still continue to dialogue and to engage our gatekeepers. Most importantly, I mean, we've gone beyond policyholders now. Now we are at the doorstep of the gatekeepers, those who will allow you, provide the legitimacy for you to be able to work in the communities. So our religious leaders, our imams, our traditional leaders, assembly members in the communities, parents and guardians, they are the ones that we are working on. Quite recently, we launched an intergenerational dialogue between parents and children, or guardians and their children, to break the silence around talking about sexual and reproductive health. And it's been very successful in the communities as well. So these are some of the ways that we go about trying to destigmatize the issues as far as sexual and reproductive health is concerned. And a lot of our people, when they hear sexual and reproductive health, they think it's about sex. And so, the initial inclination is to avoid it. But once you begin to explain to them what it means, then they ease out and then they begin to listen to you and to support. Thank you.
Abena, can I just quickly ask, you said, all this is very interesting, and I find the answers very relevant to the work we do at the Solutions Journalism Network. But can I just quickly ask, you said we have moved on from the lawmakers, and then you started talking about the community and religious leaders. Am I correct when I say you rank those in the community that you say give legitimacy to the work? Do you rank them higher than the lawmakers, and why?
No, we don't. And it's because we feel that the laws as they are now are adequate for us to work with. We would be happy if it's liberalized more. So currently, there is no law in Ghana that prohibits us or CSOs or anybody for assessing services, sexual and reproductive health services. There is no law that prohibits us from semi-legalized in Ghana, where if the woman,
Abena, I'm definitely not hearing you. Just wanted you to know.
Yes, it's cut off for quite a bit.
Yeah, it's
Abena?
cut off too. I thought it was mine.
Yeah, I feel like I missed important information.
Me too.
Okay, I think Abena is trying to reconnect. But while we wait for Abena to reconnect, she mentioned something very critical, and I have a pushback question for the journalists and veterans in the media who are attending this roundtable today. Abena had mentioned some of the challenges that existed with reportage, some of the media reportage of Srhr issues such as gender-based violence. And this is not just an issue in Ghana, I think.
Sorry, I lost out.
Oh, okay. Welcome back, Abena. I was just asked. Hi, can you hear me?
Yes, I can hear you.
Okay, I was just asking, participants based off of some of the feedback that your presentation, you had mentioned that, media reportage of Srhr issues such as gender-based violence was a challenge that, Ghana had experienced. And I know that in Nigeria is also an issue. I'm pretty sure that across countries, that is something that, advocates are facing. So it's a question to journalists as well. What are some of the pressures can we explore some of the pressures that are faced by journalists to report GBV or Srhr issues in a certain way? What are these issues, and how do we address these issues such that we begin to properly report issues around Srhr, gender-based violence appropriately in the media? Okay, I see hands raised. Adebayo, do you want? Oh, Shifa. Who wants to have a go?
Okay. Hello, how are you? My name is Shifa. So talking about the topic of teenage pregnancy, and I speak as a parent, and I am probably among so many people who may be in denial, but the COVID-19 has showed us the problem that is with teenage pregnancy, something that many of us are countries that are in denial. We just don't want to take on the responsibility of talking to young people, to adolescents about sex. It's seen as a taboo. When you bring it in schools, the parents think that you're teaching their children to have sex. But look what has just happened. How can we address this topic? How can we tell young people that they should use barriers that protect them from getting into the issue of teenage pregnancy? We have quoted, number two, we have quoted figures, 100,000 and more young people who are pregnant. But have we actually checked with the HIV infections? What does this then mean for HIV? Because those who have gotten pregnant, we know the numbers, but those who didn't and the boys who didn't, what does this mean for them if we are going to address young people? If we're going to address young people about the issue of SRH, how are we handling those issues?
Thank you very much, Shifa. Adebayo, did you want to have a go?
Yes, thank you very much. Once again, my point will be kind of complement or add to what Shifa just said. Sometimes it lies with the parents. it is a cultural thing that we believe that talking to children about sex will be introducing them to acts of immorality early in life. Then begin to ask yourself, if you want to talk about sex education to your child, it depends on what you want to teach her at what age. Many parents across Africa, let me say in Nigeria in particular, do not understand this, that education is in stages. The parent needs to identify, for example, a girl of 9, 10, 12 who had started seeing her period needs to be taught about how to manage these processes, these monthly processes. And when it comes to the time when those physical features shoots out that tends to attract a man, how to handle those situations also will come in. And when the child gets to such a stage that it is inevitable, she will have to, sooner than later, have sex with somebody of the opposite sex. In that case, we will need to let such a child realize the importance of use of contraceptive. So these are the things that some parents in Africa need to understand and teach their children as they grow. Thank you.
Absolutely. Thank you so much, Adebayo. We are almost at time. We'll be able to take only one more question. Chidera Rose Camille.
For some of us who are on radio and have had conversations around sexual and reproductive health rights, one thing has actually struck out. You know, we've talked about even the right age to have conversations with your children on around sex, but usually the challenge is when we talk about contraceptives, the young females who need to get the information do not get the right information. And this usually happens because on radio, you're not allowed to say certain things because NBC would ask you not to use the word vagina, but that's what it's called. So we had the conversation on that, and we in fact we were called by the management later to say, why did you have to use that word? But that's what it's called, right? So that's a bit of a challenge for some of us who are covering angles like this. When you want to have the conversation, you're trying to be careful because you don't want to upset certain people. But every time we're having issues, we're having cases being reported. Recently, I even heard girls go to buy a certain mixture at pharmacies where they get it because they want to prevent pregnancy. And that's something they use for ulcer, it's a treatment for ulcer, and yet to get the name. But this is something that is happening. And so our girls actually, they need access to contraceptives, but they are getting the wrong information because we are shrouding all of this in secrecy. So I think that if we can have a conversation with these people who are regulators, it would aid us a lot in reporting these issues properly. Thank you.
Absolutely. Thank you so much, Shola. Yes, for your comments. This is something that's experienced definitely in Nigeria. Okay, sorry, Chidera. Shola, you had a question. Can you please put it in the comment section? Because of time, we would email it to Abena, have her response, and then we'll send it right to you. Thank you so much. Abena, could you please address the questions that have been raised?
Thank you very much. I think I heard more of comments and also ways that we can improve providing information and access to young people and about sexual and reproductive health. So the issues of teenage pregnancy, it's across the continent. It's not only in Ghana. And for Ghana, even for us, the rate of teenage pregnancy is increasing. We also have increasing rates of sexual and gender-based violence, and we have increasing rates of early marriage as well. So when the children get pregnant, then they are given to the men as a bonus to go and marry. And then the issues of abuse also starts or maybe continues from there as well. But so we are legitimizing these, all these crimes, let me put it that way. We are legitimizing the crimes as well. And it all needs all of us to talk about it from all the angles. So for instance, the parents have their roles to play as far as providing information to their young people is concerned, talking to your child, at whichever age. My girl is 8 years, and as early as 4 years, I have started talking to her about sexual and reproductive health, her private part and what is called, what you should do, what you should not do, and what you should do when somebody touches it and all that, And at this age, at age 8 now, she's picked up and she'll tell me anything. So if we pick up the conversation with them, it will be good. So if parents work things out with their kids, teachers in schools also, provide the information and the support that is needed, and the whole community supports the girl, in as far as providing and accessing information and services is concerned. And the media, also once in a while talks about these issues and engage professionals. One very worrying trend that I've noticed in Ghana is also the fact that a lot of media people, one, they don't have the information and they don't talk to the right people. So they go calling pastors and reverend ministers, to talk about issues of reproductive health. And these people have next to no knowledge about these issues. And then they further pollute the environment. And so please, if we are going to talk about it, then we should talk to or work with those who have the requisite knowledge and the professionals, the medical doctors, the healthcare providers, those that do the advocacy, and let's get it right. And let's make sure that we are putting the right kind of information across to all sectors of the economy, of the country, so that we can get the needed results that we need. So thank you very much for this opportunity. I've really enjoyed myself. And I'm sure that we'll meet again and again and again and again. So thank you very much.
Absolutely. Thank you so much, Abina, for such critical, well-rounded insights and for responding to questions and comments. I know we really want to continue to engage with Abina, and like I said, please send your questions in the chat box. We will collate them, send to Abina, collect her responses, and send to you. We have talked a lot. The next session we're going into we pretty much segued into it in conversations around the first session that show some of the really, really critical challenges with teenage pregnancies and how young people access SRHR services. And it's our honor to introduce Lillian Benjamin Makwasi, Dr. Lillian Benjamin, actually, who's going to talk around, basically speak to the question that we've just asked, that our young people accessing SRHR services effectively should explore what is working, what is not working, and exactly how are journalists covering SRHR services. Dr. Lillian is steeped, as we know, in SRHR advocacy in East Africa. She understands SRHR issues both in Africa and around the world, and she's conversant with the workings of the media as well as journalists. She is a Dare for Progress co-founder, adolescents and young women technical advisor, Compass Africa, Athena, Women Deliver Young Leader, as well as she's a differentiated care youth champion of 2017. Lillian, it is an honor to have you speak with us over the next 15 minutes. Over to you, Lillian.
Thank you so much, Dara, for the great introduction. And maybe to begin with, I would really like to commend Abina for such a robust, detailed presentation that she has just done, understanding that we are all coming from the African continent. I must say, almost everything that she said is also applying to the communities that I come from. I come from the United Republic of Tanzania. I represent, in this case, the Eastern African zone, but almost all issues that she has highlighted are similar to the things that we see are causing troubles and, making that our progress around sexual and reproductive health gains remains very little or slow progress I would say. And to begin with, I would like to address the question whether or not young people at the moment are accessing sexual and reproductive health services effectively. So first of all, I'd like for us to understand the term sexual and reproductive health service, SRHR generally. It's easy to wrap everything that is involved in sexual and reproductive health rights into these 4 letters, but it's very necessary for us to remember that it covers a wide range of issues and wellness concerning our communities within this umbrella of sexual and reproductive health and rights. We have family planning, of which when you're talking to young people who are not married, they prefer the term contraceptives instead of family planning, because the term family planning itself, it stands as something that is designated for people who are married, who are ready to start a family, and automatically they feel excluded when you use the term family planning. But also we have other areas that is necessary to focus on when speaking of sexual and reproductive health and rights, including HIV, gender and gender-based violence, menstrual health. Someone has mentioned that in the comments, which was really amazing to hear. But also there have been concerns of late, as you may have seen the wave. We can't escape to talk about mental health and COVID-19 when it comes to sexual and reproductive health and rights, because if these two are not set right, it means access to every other service that is falling under the discipline of SRHR is also compromised. So do young people at the moment access SRHR effectively? Absolutely no. And this is evident as we can look at maybe in our country context at the rates of and the numbers of teenage pregnancies, the numbers of rape cases that keep coming. We can also look at the progress towards the 395s in our countries, but also HIV infections, which I'd like to give an example on. For instance, in my country, Tanzania, young people aged 15 to 24 take up 40% of new HIV cases every year, meaning in every 10 new cases we get in Tanzania, 4 of them are young people aged between 15 to 24. And when you look at this 40%, if you break it down again, you realize adolescent girls and young women take up 80% of those new infections among young people. And this is similar to most countries in the Southern and Eastern African region. So the burden of HIV infection is also really weighing young people down. And you realize this doesn't mean that our countries are not doing anything at the moment in terms of making sure that services are available, making sure that they meet the needs of our people. But like, it also speaks to the fact that despite the incredible strides that and progress that is being made, there is something that we're not doing right when it comes to young people. And that's why we're still not able to fully address their needs. And so I would like to go directly to the things that I think are not working at the moment based on my experience engaging with communities, especially adolescents and youth, and maybe more specifically adolescent girls and young women, given the context that we are in at the moment. So there have been lots of ongoing inequities as regards to accessing, first of all, information as regards to sexual and reproductive health and rights. And as I commended Abena, she mentioned and gave a lot of examples around that. We have had a lot of concerns around when and when not to when to start talking to young people about their sexual and reproductive health. And we've had struggles, for instance, at a country level where there's certain information. We have different levels of, educations. We have primary school, and then we have the secondary level, and then we have the advanced secondary level, and then universities. But we've been in situations several times where we actually told by the government that you can't actually go to primary schools and talk to them about certain informations, which automatically hinders access to right and correct information to these young people. But also we have had concerns around, we have parents at home, the people that actually spend most of the time with these young people. We have parents at home at the moment who are thinking sending their child to school automatically gives them access to sexual and reproductive health information. But when you go to school, again, you meet these parents these teachers who are actually parents coming from, like you have heard, conservative communities, religious communities, who actually second guess the amount of information they are yet to, give to the children or young people who they are teaching. So we have all these ongoing barriers as regards to how information is being accessed to young people, let alone the fact that now that we have digital advancement picking the pace so fast, but that we have, again, the ongoing inequities in terms of how young people, adolescents and young people are able to access, internet, digital smart devices. And this is causing more gaps in terms of how young people access information. There's also ongoing inequities in terms of how services are being delivered. Again, in terms of access, but also accessing these services and knowing where to get these services is one thing, but then uptake and creating an environment that can make these young people take up the services is another. So there've been a lot of concerns when you talk to young people as regarding to the challenges they face in terms of accessing sexual and reproductive health services. And they will tell you things like unfriendly services. They're being judged by healthcare providers, the questions they're being asked. A young person goes to the clinic wanting to access maybe contraceptives. And then the first question they're being asked is, why are you having sex? You look so young. Why are you doing this? And, importing the judgmental thinking and perception into this person will make them not show up next time to access services. Other areas that things are not working well is actually we are missing at the moment the leadership of young people in how sexual and reproductive health services are being tailored and delivered to young people. It's one thing to create a program that looks incredible in the minds of older people who are termed as experts and technical persons. And it is a completely another thing when you sit with actually these young people that you want to eventually send the services to and get ideas from them on how they want to receive these services. This creates ownership, and it makes them it builds that sense of ownership, and it makes them eager to want to access these services. But the minute young older people sit in the rooms and then they create programs, and then that's when they deliver them to young people, and they sit and wonder why is it that they're not the uptake of services is low. It's pretty much because they were not involved from the beginning. And of late, we've been talking around making sure that these, whether it's tools, whether it's services, making sure that we have young people on board from even the ideation process of creating these programs. Another area that I think needs our attention today would be, that is not working, would be the low interest in science or health reporting among our media persons. And with that, I mean, I spend a lot of time on social media, and maybe most of us do as well. And we would see how when maybe an artist, like maybe for instance in Tanzania, we have diamond platinums, or maybe say, like who can I think of? Maybe Davido, or who else? Okay, any that we can think of, maybe Tiwa Savage has done something. You'd realize that information runs across our digital, devices a lot faster than anything. We pay, and it's the community, how we have structured the community, maybe rather how the media has structured the community, that they're easily interested in gossip, information, salty information, instead of, focusing the energy in things that can actually build our communities and young people. So there've been certain trends of not having health-related or science-related information covered in a way that attracts the attention of our communities. They're termed as boring, and we don't have as many, reporters or storytellers who are focusing their interest into the science and translating it in a language that is interesting for communities to be making a fuss about and, gain interest and follow up on what's right to know regarding our health. But also one other area for this particular part that is not working, and I'll give an example of my country with this one, is lack of a political will when it comes to sexual and reproductive health of our young people, adolescents and young people. We have had a lot of policies that are sabotaging access to health and information for adolescents and young people, especially young women in my country. And I'll give an example of, like Abena had mentioned, in Ghana, we also have laws that actually criminalize abortion in Tanzania. We have laws that criminalize sex work in Tanzania. We have had secular overtime that actually sabotage young mothers' access back to school. As you might have heard in my country's previous leadership, there was a circular that any girl that gets pregnant is not allowed to come back to the formal, education system of Tanzania. And that has lasted for over the last 3, 4, 5 years. And a lot of young women lost hope, and they were not able to access education after giving birth. Remind you that we already have issues, we already have gaps in how access to sexual and reproductive health information is being delivered to these young people. And yet we are here creating circulars and laws that are actually sabotaging what they face, the consequences they face, and their access to education as well. We have had struggles also around the Marriage Act of Tanzania, where we say the age, contradicting laws, we say the age of consent to sex is 18 years of age, but we have a Marriage Act that allows a young girl below the age of 15 to be married off under her parents' consent. Or any can decide between 15 and 17, you can decide to get married. And once you do so, you're off, you can go. But again, these are the laws that, again, they continue to sabotage these young women. And we have seen a lot of, a number of leaders who actually stand by these laws. They actually support them, and they can't even, like, looking at where the world is at the moment, try to look for a way that it can actually make it better for young girls, for adolescents and youth to have better education. As you may have known, of late, research has shown keeping girls in school helps prevent early sexual debut, but also teenage pregnancies and contracting HIV infections for these young women. And okay, enough with what's not working for now. I could mention more, but maybe let's focus on some of the things that I think can be done better or are currently working in this context. You may have heard of something called combination prevention, and this applies in all sexual and reproductive health issues affecting adolescents and youth in our countries. This is a space where you combine structural, biomedical, but also behavioral perspectives, behavioral disciplines in how we address concerns of our communities and how we solve problems affecting our communities. This brings in a sense of bringing everybody together. We know some of the issues that I've mentioned, they're highly affected at an individual level, how people behave, the communities we live in. But also when you look at the structures, again, we look at the political wheels, the regulations, what do they say? How are they supportive of how these young people can access services, but also the biomedical point of view. Now it's how they can access actually services that can prevent them from teenage pregnancies, HIV, sexually transmitted infections, and the likes. So combining these three together as of research has proven to be one of the best ways that we can actually address sexual and reproductive health issues of our community. And this goes hand in hand with now integration. Integration, by simple examples, is what we are doing at the moment here. We have people from different disciplines. For instance, we have the media persons, we have people who are working with the communities directly, we have the medical experiences brought in together to have a dialogue on how we can actually be allies and look at different ways that and learn from each other, different things that we can do to ensure that we actually make access to sexual and reproductive health services for adolescents and youth much better. And another thing that can work and has been working so far so good is meaningful engagement of these young people. And this goes now down to the ideation of programs, whether it's research or programs, into implementation of these programs, making sure that young people enjoy when they're provided actually something you would get from them when you talk to them. They actually enjoy receiving services from people who look like them, people who have young personalities, people who are actually young, to attend them and give them services. But what are our governments doing in maximizing that opportunity, coming straight from young people themselves? And by meaningful engagement, also it means taking them with us from not just implementation and supporting activities. Yeah, it goes all the way to even how we close programs. For instance, maybe we have conducted an HIV program and we're at the end of the program. There are different ways that programs are being monitored and lessons are being taken on to inform the next phases or the future programs. And if you bring in young people on board up to such levels, it means they are given also the opportunity to learn and inform better in the future engagements they are given. But at the moment, we don't have much of that going on. I'll think of one or two different programs in Tanzania that are targeting adolescent girls and young women that has practiced meaningful engagement pretty well. And you might have heard of the Dreams Initiative, but also we have the Global Fund Timiza Malengo. These are two almost alike comprehensive programs that are targeting adolescent girls and young women, looking at how their risk to HIV infections are affected by different factors in our community: the economy, creativity, lack of, lack of information, poor access to services. And the programs are tailored in a way that they're able to address all these concerns of adolescent girls and young women that in one way or the other put them at risk. But also these programs go further to look at other secondary targets of the program, as in the sexual partners of these young women, who are the parents of these young women, who are the religious leaders of these young women in the communities that they live in, and look at different ways that they can actually talk to them and influence and sensitize them to further support young women to access services much easily, compared to when you're just focusing on just the target, the primary target for adolescent girls and young women. And also there's a point around innovation, and we have had a number of programs that are looking at different ways to create one-stop shops. And these innovations are based on what these young people, when you sit with them, now meaningful engagement, and you ask them what really works for them, and they give you their solutions. When you sit with them and learn what their needs are, you study their needs and you're trying to address them. It's called human-centered design. You study their needs and you try to address those needs that in one way or the other put them at risk of teenage pregnancies, gender-based violence and the likes, and you're able to address them and given what they had proposed in terms of solutions. And with innovations here, you can talk about a number of things that are ongoing at the moment. We have one-stop shops. This is a space where a young person can walk in and access whether it's STI screening, family planning services, HIV services, menstrual health information, counseling, therapy, COVID information, just to mention like an example. This is a center where they just walk in and they get all these services at the same place. But like these are really really implemented in very limited spaces in our community because of limitation of resources. So it actually solved the issues around young people moving from, I'll give an example. I'm a young woman, I'm 28, and I have a couple of issues in my daily lives that I have to address. I need to prevent myself from getting pregnant. At the same time, I need to prevent myself from getting HIV. But to think of the way the structures of our health systems are at the moment, I am forced to walk into different clinics sometimes to be able to access mental health support, to be able to access contraceptives, to be able to access HIV services. And to think of it, when you look at younger people, they don't have that time to move into one clinic to another for different services. Instead, it works, for instance, to have all these services put in one place because they value their time. They have other things to do. They need to grow. They need to develop their talents. So they don't want to spend much of their time moving from one health center to another. But if you have these services put closer in one space for them, it makes it easier to access services. And also, in another way we can look at this is how we currently have innovations, advancements in terms of how, for instance, HIV prevention options are being available. Family planning has always had diverse services young people can pick from. You have the IUD device, you have condoms, you have pills, you have the morning after, you have the injectable contraceptive. So for instance, for the case of HIV, that has not been the case for a very long time. It was either you use condoms or rather you use something, abstinence and the likes, which are not practical. So having the space where advancement is bringing in new tools like pre-exposure prophylaxis and the dapivirine vaginal ring, it makes it easier for young people to have choice and, you know, be able to access all this information. And maybe moving forward, given my experience engaging with journalists, these are some of the things that I think have been working so far from my end, much as they are not again scaled up. It only applies to a few groups of journalists that we have worked with. It's been quite an awakening season for now that the media is a very powerful advocacy tool. So if we work closely with journalists, it's easy to communicate information to our communities, but also our decision makers, to create an environment that is more friendly, to young people and their access to sexual and reproductive health and rights. And it's been really helpful to slowly building partnership between media, scientists, the ministries involved, the ministries of health, but also healthcare providers and scientists generally, to create a space where they're able to actually create stories, you know, report information that is helpful and impactful to our communities. I'm not sure if my time is up already, Dara.
Yes, it is.
Pick it up from here.
Thank you so much, Lillian, for such. I mean, we obviously could have you go on because of the critical insights that you bring, especially as a young but really well-skilled SRHR advocate. You bring the perspectives of someone who's young, but also someone who is an expert in the field. And I think that is something that the media, my colleagues on the call who's the media, really needs. You brought up a lot of issues. What is working? What's not working? What are the opportunities for insight? And I think that if we have a lot of solutions journalists on the call, and if you're like me, you're thinking about, you know, for some of the things that are working, for some of the things that are not working, you're thinking of story ideas, you're thinking of solutions journalism story ideas, basically to spur accountability for what is not working, how it can work across the country. I won't keep going on and on. Now it's time for questions. As you must have guessed, we are very big on this being a very interactive session. If you have any questions, comments, experiences that you want to share that relate to the experiences that Dr. Lillian had shared, please jump. Oh, okay. I see hands raised already. Babatunde Okunlola, you have a question. Please go.
Right. Hello, everyone. First things first, I want to thank everyone who's come on board, and especially to Dr. Lillian, who just spoke a
Oh,
while
I'm sorry,
back.
is it just me? I can barely hear you.
Okay, is it better now?
It's better. Yes,
Okay,
thank you.
all right. I'm sorry about that. Again, I'm really excited about this session. It's been quite an eye opener. Perhaps it's because you're amongst colleagues and friends. I put something up while Dr. Lillian was talking, and because the first statement, the first point she made struck a chord. And the reaction is this: how do we reach a generation whose language we don't speak at all? She really made great points about from simple terminologies like preferences, like phrases like family planning, to the use of contraceptives, speaking the language. And I think she's absolutely right. It's the era of the pop culture we live in. Young people listen to certain figures, superstars, amongst a couple of other things. So, in an era where most times, from experience, we tend to have focused so much more on, the cultural leaders and the religious leaders in this part of the world. I think it's high time we started broadening those conversations as well to include, the pop stars, people who are supposedly influencers. Shouldn't we be including them? And I ask this, because amongst even media practitioners in this era where we should be collaborating, instead of monopolizing roles. We've seen that happen time and time again in the era from major media platforms, to everything being broken down to the blog era. There's a lot we seem to have taken for granted somewhat, as media giants, as gatekeepers, the official channels. But right now, as we see them, we see a lot of that being demystified. And isn't it the right time for us to also include those people as against the traditional beliefs that, okay, the cultural leaders are being included, the religious leaders are being included, making efforts as well to bring these other influences that young people listen to in order to pass these messages across. That's it.
Thank you so much, Babatunde. I think that I would let you answer that question, Dr. Lillian. And basically, this is a question to Dr. Lillian and to all of us on the call. How do we reach people whose language we don't necessarily speak? How do we make issues such as Srhr, how do we make it glamorous, like Dr. Lillian had said, how to make it a lot more glamorous such that more people want to report on these critical issues. Before I jump to you, Lillian, Melanie has a question. Melanie Shola, here we go. Melanie, you had your hands raised.
Yes, I did. Good morning, everyone. Good afternoon, I meant. Please do not mind me. All right, yeah. I mean, it's been a great session here today, and a lot has been learned. I remember the first lady who spoke from Ghana, Abina. I think for me, she just literally opened my eyes and sort of made me realize that some of these things we're fighting are actually not local at the end of the day. They're sort of global. It's about the story of every woman at the end of the day. However, having heard Dr. Lillian speak, I think that, again, corroborating what Tunde said in part, that there is the need for us to make the conversation everybody's problem, in the sense that in our kind of society, a lot of respect is paid religious leaders. And that's where I want to pitch my tent. And that's because in the past, I've had to engage religious leaders on the issues of female genital mutilation. First, beginning by asking them questions regarding their own deep-rooted belief and their stance on this, and eventually getting them to commit to creating a bit of change by means of educating their immediate community. So I also feel that because of the kind of power that religious leaders wield amongst us, it is indeed very important that we sort of break into that space and get them to work together with us as well. I mean, you hear it on radio and television all the time. And if some people still haven't heard it, that it is right or wrong. In this case, I use female genital mutilation, that it is not religious for them to actually do it, all right? Some people still do not want to abandon the practice. So I just see an intersection here where a lot of fields, professions, just have to come together, to drive home our points and get results.
Absolutely. Thank you so much for your question, for your comments, Melody. Shola, I see you have had your hands raised.
Hi, good afternoon. Good afternoon. I totally enjoyed, like, I've from Abina's session to Dr. Lillian's session. Okay, so I'd like to say that Dr. Lillian mentioned something about the language. And when we talk about sex education, we have a lot of topics under it. Like the last person who spoke talked about female genital mutilation. We have menstrual health and management. Like we have a whole lot of topic that has to do with around sex and reproductive health. Do you think that because there's this stiff, how do I say it now, attitude, towards sex education, do you think that we should do something about the name sex education so as to make it more acceptable, especially in schools, at homes? Because for a lot of mothers, I wouldn't blame a lot of mothers because I walk around this topic, because it was passed down, the culture of silence around this subject matter was passed down to them. So a lot of mothers leave their female children to figure it out. So while trying to make people accept this gospel of MHM, female genital mutilation and others, do you think that we should change or we should do something about generalizing these topics under sex education? Do you get what?
Yeah, to jump in, just like what you just said about sex education, terminology. I've had, I think Dr. Abina saying when they invite parents to talk about sex education or sexual and reproductive health and rights, that they want to shy away from that topic. Some people think that when you're talking about sex, reproductive health and rights, you're also talking about gay rights. Not a bad topic, but this is what they say. They want to introduce to us those things. Family planning. If you're talking to young people and you tell them family planning, they have no families to plan. Even if they are pregnant or have one child, they feel like this is for all people. So this is a topic or a conversation that is very important. Even if it's right now the terminology generally globally that is accepted is sexual and reproductive health and right. When you are organizing a meeting or a talk, what do you call it? If you're going to talk to people or to people in the community, you can term it in a different way, something that they can accept. When I'm writing a story and I talk about maternal mortality and morbidity, people don't understand. But if I say why women die, why babies die, it's much easier to understand. So even we don't have to use the globally acceptable terms, we can define it locally so that we communicate to the people we are talking to. Let's not tell young people about family planning. Let's tell them about early sex, teenage pregnancy, and the responsibilities that come with that.
Absolutely. Thank you so much for your comments and then your question, Shola. Decentralizing, disaggregating all of the big terms that we use around sexual reproductive health. But I won't preempt you, Dr. Lillian. 3 critical comments and questions have come. Can you speak to those questions and speak to those comments as well, and sort of use that as an opportunity to wrap up beautifully this, what has been a very inspiring session. Over to you.
Thank you so much, Dara. So regarding the first question on how do we involve people whose language we don't speak when it comes to communicating sexual and reproductive health and rights generally, I think it goes back to now meaningful engagement, having them on board. As in, before you want to write a story, before you want to create a program, before you want to create a social media advocacy plan or social media plan, it's necessary to involve the people that you actually intend to speak to. The times are changing, yeah? I may have language now that me and my fellow 20s can understand and find glamorous. But when you go to the 15s and 14s and 17s and 18s, they have their own, cool items that they talk about. So it really helps from time to time to go back to those groups and, talk to them directly, but also to avoid the inconvenience of going back and forth. You can always bring them on board, like have them in your team. I believe, for instance, for journalists, we have journalists that are young, like quite young, and they belong to those groups. So what do we do to have them on board, to have them in these intergenerational spaces where we can discuss different things and learn from each other? In one way or the other, it creates a connection. It creates a space where you can actually borrow ideas, you can borrow terminologies, you can learn a lot of things when you facilitate spaces where you can exchange learning with younger generations or older generations, intergenerational spaces. But also there was a concern and rather a question around Bisola, around the attitude around the term sex education. I think at the end of the day, much as it's easier, of course, I encourage using terms that are actually more friendly to the communities you're targeting. But at the end of the day, I wouldn't recommend a situation where we continue to seal the word sex for other words, because the stigma will continue to be there. So while we're looking for different ways to present the information that our communities can understand, let's have it in the back of our minds that at the end of the day, we need to make the terms no longer a taboo to say sex, vagina, condoms in public, as long as we're meaning well and we intend to give the right information for people who might need at different spaces in life, things we cannot control. And there's ongoing lots of misinformation around, now the attitude around sex and the likes. It is our role again for us in the spaces to sensitize our communities in a way that works. That's why we even do trainings sometimes with religious leaders, so that they can understanding the influence in the communities. If they're given the right information, that means we can easily access our communities. They can talk directly to our communities. And very importantly, we oftentimes forget that even the parents that we are talking to sometimes, they also lived they lived in the times where they had no correct information. So perhaps we need to also focus on what to tell parents, to encourage parents to take, lessons around how they can talk to their children, have those spaces for them as well, talk to them as well, so that they can learn new information and new ways to communicate to our younger people. Thank you so much. Dara, over to you.
Thank you. Thank you so much, Lillian, for giving us such critical insights and responses to questions that have been raised. I mean, piggybacking on what you said, we've got to stop making some of these terminologies taboo. And I think that if you look at the landscape about how some of these terminologies came about that alienate young people, such as family planning, came about by, because some of these terms that are used, that are supposed to be properly used, are actually they were actually considered as taboo. For example, you can't go into a community and mention contraceptives, so we decided to call it family planning. So it's best to continue to walk into a space where these terms are not considered taboo, and where we stop alienating young people who are coming up, and people who have ready, quick access to information, whether we are willing to share it or not. The internet is available for many young people, whether we want to say it or not. Okay, thank you for wrapping up that session beautifully, Lillian. It's exciting to jump very quickly into the next session, where Shifa Mesigwe is going to talk through some of the challenges, or rather improving Srhr uptake in Nigeria, and explore why communication matters. This is really the meat of why we're here. How do we improve Srhr in Nigeria? What is the critical role of you, our colleagues here? Shifa is a communication specialist. She's a writer and award-winning journalist. She has 10 years of national and international experience in communications management, journalism, advocacy, human rights, and development work. We are excited to have you join us and speak for over the next 10 minutes, Shifa. Over to you.
Thank you very much. Good afternoon once again, everyone. when Dr. Lillian was speaking, she talked about the low interest of health reporting. But today, if you had doubt about the work you do as a health reporter, now is the time to know that your story being on page 26 is not an issue anymore. COVID-19 has reminded us and has reminded the world that health reporting is very important. So communicating about health, sexual and reproductive health, now you know that it is very important that if we are not healthy, that health can disorganize all our work around the world. So Corona has reminded you that subsequently that health reporting is important to provide factual health news and information. So now you know why it is important to you as a journalist to stand up and write factual information. So remember that when you feel like you doubt your contribution to this newspaper or news segment on TV where the political news comes first. One of the things that I find when I was a reporter, or that you probably also come across when you as a reporter, is to remember why are you doing what you're doing. You need to look within yourself and define why you're writing, why you're reporting as a journalist. If you are a young journalist, you're probably reporting because you just want to write, you just want to get your byline, you just want to appear on TV as you're just starting. And then as you go on, you need to define your purpose as a journalist. Why am I doing what I'm doing? What is my purpose? So if you don't stand for something, you will fall for everything. So if you define why you're writing a particular story, then you will see what you want that story to achieve. Do you just want to win awards? Do you just want to hand in stories at the end of the day? Or do you want to cause change? And for me, when I was writing, I wanted to see some sort of change. But then as you go along the way, you can't be bogged down by fatigue when you write and you write this and you really get tired and you feel like I've written about this thing so many times, and then you feel like you're not adding anything. But you need to also look within yourself and remember and come back again to your purpose, which is change journalism, or what we now define as solutions journalism. So now when you want to write about teenage pregnancy, that's a problem. Everyone is talking about it in general, broad sense, teenage pregnancy. Oh, many teenagers are now pregnant. What is the solution? What should we be doing? Why are pregnancies high, and how can we address them? This is the platform of solutions journalism that we are on now. And when you as a journalist write about teenage pregnancy, if I can insist on that example, if you really don't know the solutions, you have the experts to ask and let them take you through. You don't have to be a PR mouth for one organization. You can ask this organization that is an expert in that topic, and ask that organization and read reports and then come up with solutions that you suggest in your story, so that you're not just lamenting, but you're also providing a solution of what you want to see. Then what do you do to write well? You as a journalist, you need to remember that whatever you do, whatever you're writing, whatever you're reporting on TV or on radio, stories are about people. So for example, teenage pregnancy. Everyone knows it's an issue right now, even in my country. I come from Uganda. Hello, Dr. Lillian from East Africa. So when you're writing teenage pregnancy, who do you want to speak for the story? Do you want policymakers, MPs, or members of parliament or senators to speak? Maybe you want to invite parents to to speak to the world and tell them what actually happened. You as a parent, when you found out that your child was pregnant, what did that mean to you? Or the teenager who's pregnant at that time, what does she know what it means now to have a child when she's still young? Can she speak to her fellow teenagers? Can she speak to politicians, decision makers, policy makers, and give this story a face? This is something, I don't know whether it's just me lazy, but the stories I have been seeing are just talking about the figures. Teenage pregnancy has gone up. This region has so many, that region has so many. But I want to see parents, because this is, we always say parents, they are in denial. I want them to come and tell us what actually happened. I want teenagers to tell us what happened. I want young boys, maybe those who are responsible for the pregnancies, to come and tell us what happened. We need to shock this world into this issue. As a reporter, if you want your story to matter, if you want your communication to cause something, you have to remember numbers. Numbers are the Achilles heels for your stories. So you cannot just write theory and just speak theoretically. Give us some numbers. Numbers throw perspective on what you're speaking about. Numbers about the teenage pregnancy issues in your community, in your country, but then also globally, compared to last year, compared to the other year. Why do they say that they have gone up in the time of COVID? What happened last year or the years before that? Then you need to look at, going back to why communication is important. You want to cause change. So what sort of change do you want to cause? Maybe you want parents to change their mind and start speaking to their children about the issues. So how do you address them? Maybe you want to speak about, parents who have handled this issue to come and talk to parents. But most importantly, if you want to talk to politicians, to decision makers, people in the Senate, show them why people are suffering and why they need their help. And look at, because it is Parliament that can cause change, it's them that can make the policies, them that can sign to pass budgets. So demand for this, write stories that directly speak to them and show them what the problem is and why their input is needed to cause change. When do you report? As a communicator, and why communication is important, you need to define when you actually want to report for your story to cause change. When an issue is in the news now, this gives you an opportunity to explore it in a broad way. There's that breaking news, everyone talks about it, but you need to then explore the issue of teenage pregnancy in all perspectives: sexual and reproductive health and rights, sex education, what solutions are there for young people, parents and talking to their children, influencers coming up to join the conversation, peer-to-peer education for young people. So now is the time to use that opportunity to talk teenage pregnancy on a broad level. Then if you want to see your story cause change, I think Dr. Abina talked about budgeting for sexual and reproductive health and rights. When you want to see that budget allocation for these issues improve, when do you actually report? When will your communication matter? So I would imagine for many governments, budgeting for budget allocation will start around January, that conversations will start then. Maybe this is when you want to actually write stories, when you want to see that there is better allocation of funding for health and reproductive health, when the budget is read in June for the countries that read their budgets in June. So you need to know when you can actually start reporting. Do not report about the budget after it has been passed. You can analyze it when it's been passed and talk about whether this is good allocation or it's bad, and keep it in mind for this. You can come back to this budget in January before the next budget reading. But if you want to actually cause change, you need to know when to report. If there is a discussion about a law, a bill in Parliament, this is when you should actually discuss issues that concern that. The MPDSR bill has just been passed. I don't think now is the best time. You can discuss the bill, but the time before that passing of that bill, I think even Nigeria Health Watch did a lot of reporting about community MPDSR. That was the best time to actually report and communicate about that issue, so that you see that this issue is brought to the front in Senate, and you show that it's important to your country, so that the bill is passed, because it's for the good of everyone. And as a journalist, many times we fall into the habit of just handing in stories. You just want for media houses that have story count, you just want to beat the story count. And then you write this story and write the other story, and you will find some very interesting topics. You do not follow up. When you start something, finish what you started. Write today, follow up on the same issue tomorrow, follow it up to the end. If you know what sort of cause or change you want to cause, follow your story to the end until you see that something has happened. And you will see so many organizations will be available to support you first, even if it's just with information, to make sure that you see your issue to the end, or maybe facilitate your reporting as well. There are those that can support you on that front. Then also, as a journalist, I don't remember, is it Babatunde who talked about times have changed? You personally, as a person, it's not enough anymore to be the reporter of a certain news agency. It's not enough anymore. Times have changed now. TV reporters now have their own YouTube channels where they create content around the issues that they actually report about. So maybe you need to create use your own personal channels to continue to communicate about the issues that you want to see change. So if it's YouTube, there's small YouTube stories. Maybe you want to communicate on Instagram in a way that is in now on Instagram. I've seen a lot of profiles of Nigerians on LinkedIn, really good profiles. So you as a journalist, maybe you want to jump on that and create your profile where you can share your thoughts and your notes about the issues that you report about, so that you don't just stop at being someone's employee, and then you also build your own personal profile as a journalist. You want to maybe write a blog.
Yes.
You want to write a blog, you want to start a podcast, maybe as a journalist, even if it's 15 minutes. Maybe you want to join the short conversation with these short video webs, TikTok, Instagram stories, video. I think Facebook has started it, WhatsApp has those short stories. So you want to jump on the wave of creating those short videos as yourself. You can be creative with your ideas. Yesterday, I watched a report on BBC about nuns and imams who are now on TikTok. So can you imagine nuns on TikTok? But they are sending out their message actually. So maybe you can also join that. Remember, these days, most people, even your fellow politicians who seem to be busy, in the evening, they are checking out Facebook status and their WhatsApp statuses. And this is where videos from TikTok and Instagram are also shared there. Yours may fall into that status update, and then it will reach the person you want to reach. So it's important that even when you follow up, even with the newspaper, follow up even on your personal, in your free time and your personal time. I think that's all I had to share.
Thank you so much. Thank you so much, Shifa. I think one of the critical things that I'm going to be taking out of this session is follow-up. And as you mentioned it, that as journalists in this space, we have so many competing priorities. You know, you need to meet a quota, but it's really critical to see an issue through to the end. Thank you for the practical insights. Any questions? I know that Shifa has really laid out a lot of food for thought for a lot of us as journalists. Do we have questions? Okay, while we wait for one or two questions, Shifa, I had a question for you. You mentioned utilizing following up to the end and utilizing innovative ways to, take advantage of technology to follow up our stories and complete them. How do you balance this? How do you balance the need to meet certain quotas, especially at newsrooms, with the need to be thorough and follow up stories? How do you balance both very quickly?
So unless your newspaper is, or your media house is just keeping you really busy and taking up like 20 hours of your time, I found that sometimes we may create that thought in our heads that I'm too busy, I have too much work to do. Okay, there's stresses of the world come, but you need to know what you want as a person. Young people are out there building themselves, building their profiles. And if you don't jump on, if you don't create time to create your own content, other people are doing that. So there's someone I know that for that person, every time, at a certain time in their life, every time they are either doing a course, even if it's just a language course, even if it's just an online course for 6 weeks, they are doing something. So you don't even have to do this every week. But if you define what you want to do and you're deliberate about what you want to do, you can save two hours in your Saturday to write a blog. Or, TikTok video, if you conceptualize, it's when you're sleeping, an idea can come up. A TikTok video can take you maybe 10, 20, 30 minutes, and your children can even help you to create this stuff and even edit it. So if you know what you want, the trick is to start. The time is then you decide when you want to do that. But please just don't be too busy for yourself and for creating your own profile, because so many other people are out there doing it. So for me, yeah, that's my take.
Thank you so much, Shifa. I think the practical insight that you have shared with us is one of the critical things that I'm taking out of this roundtable today. Don't be too busy, to all of us, to all our colleagues, don't be too busy to create content, create a profile for yourself as an expert journalist around these critical fields. Thank you for this insightful session. The feedback from from the chat boxes that your insights have really helped to, contextualize all of the data, all of the expert information that we've gotten from Abena and then from Dr. Lillian. And then, so we now go into putting these information into practice. Thanks a lot again, Shifa. I will jump right now to my colleague Chibike. We are wrapping up, as it were. My colleague Chibike Alagoso and Nelly Kalu will share over the next few minutes some more practical insights, how to find SRHR ideas with the systems map, and that will segue to the session with Chibike and Babatunde Ukunola over the next 3 minutes or so around next steps and opportunities. Chibike?
Hi everyone. Can you confirm you can hear me?
Yep, yes we can.
Thank you very much, Dara. Thank you so much, Shifa, Abina, and Dr. Lillian for those amazing insights you've all shared with us. So over the next 2 minutes, like Dara said, I'll just quickly show us journalist colleagues in the house something that we've come up with, as the conversations went on. So we've had this great conversation. So the next thing is what next? As journalists, it also came up strongly from so many of the things that were said. How do we take these conversations, use them to write stories that will inform people who have the capacity to act, the policymakers, or even citizens to demand these services. So it goes down to our story ideas, the editorials that we're going to put out from there. So, but how do we take all of that and put them into stories? Because there are so many issues, there are so many things that have been mentioned. There are both these things that are working in different contexts. I know we have journalists from Nigeria and outside Nigeria. So what are those things working and what are those things not working, and how do we put them into stories? So, and to do that, you use this concept called systems thinking. It's very helpful with that. So because essentially what we are trying to address here is sexual and reproductive health and rights issues. How do we make sure that young people have access to these services? How do we make sure that whether young, married or married, have access to these services so they're able to live to their full potentials and help to the development of the country? And as we all know, that's the theme of this conversation that we're having here today. So it's a whole system, and it can't be changed overnight. I know there's so many ways we can want this system to change, but it can't be changed at the snap of a finger. There are little things, little areas, or what we call nodes that connect together to impact on the system. So it's always good when we hear all of these things, you put on your systems thinking cap and look at it from a systems approach. And when that happens, what you now end up doing is to create a systems map. So we're talking of sexual and reproductive health and rights. There's talk about education, there's talk about meaningful youth engagement, there's talk about gatekeepers, people who legitimize these things, who give access to communities, who give their consent, so we have access to even young people to educate them. So these are smaller things, and when you tweak them, improve them, they go ahead to impact on the general system. Okay, so it's good to always focus on those little what's working. So imagine you want to report on sexual and reproductive health and rights. You don't have to look at it as a whole. So you just look at the smaller issues, who is doing it right, and that way you're able to write stories that impact on the general system. So you're not looking at changes either positively or negatively, because these changes can affect the entire system. So it's always good to now focus your stories on those smaller issues. So for example, we're taking insights from Tanzania, like Dr. Lillian shared. What are the things working in Tanzania? As a Nigerian journalist, what can we learn from them? So you can take those, like I said, you don't have to focus on the entire thing. Take those smaller things that are working and report on them so Nigeria can learn from them. Applying those will go ahead, by the time a lot of people are doing it, it goes ahead to impact on the larger system. So that's why it's good to think of these issues in a systems way. So you write about what's working in small areas. It can be in Nigeria, it can be outside Nigeria. So if it's working in one location, we can talk about it and encourage other locations or other states to adopt it. So this is just a sample of what it looks like. So you see the larger issue here is sexual and reproductive health and rights, okay? So there are things that affect it. Access, we're talking of how do we make sure that people have access to it. And when these services are provided, how do we make sure that it's even taken up? So you don't have services in the facility and young people don't go to take them up, like Lillian said, where you have elderly people coming up with programs or interventions, and when they put them out, young people don't come to take up those services. So you see, these are smaller issues, by when you do them right, they impact on the bigger system, which is Srhr. So what are the challenges? What are those issues? And when you break it down, when you go to assets, you're talking of the fundings there, the policies there, do you have meaningful youth engagement? So many little issues. So we've been taking notes and trying to create this map in the interest of time, so we don't take our time. These are some of the things that emerged from all the conversations. So okay, share the same picture. This is supposed to be Ghana and Tanzania. So how are all of these connected, and how can you find story ideas in all of these little issues? What's working in this area? What are the issues? What are the challenges? How are they addressing them? So when you look at them, you focus on those smaller areas and find story ideas there. Okay, you see that when you write on those, it's lessons for the entire system and it helps improve the entire system. So we're going to be working on this. I just wanted to share this, so you can also be thinking of it beyond this Srhr, other issues that we write about as health journalists, as journalists generally, or as media persons or communicators. But we'll be finishing up on this and sharing it along with all of us who participated in this amazing roundtable of discussion that we had. I will also have a report of a blog that we're going to be putting out, and that systems map will be part of it. So when you're looking at it, you're looking at the smaller issues that impact on the big system, and that way it's easier for you to find story ideas. So yeah, as far as next steps goes, I think I saw it in the chat somewhere. We put this together with the support of Internews. They have their health journalism network. I think Babatunde, if you're still here, you can say a thing or two about that. So there will be opportunities following this. Like I said, when you look at this system, there are story ideas there. So if funding is the issue, the Internews has an opportunity to support that with some story commissions. At Nigeria Health Watch also, we have our Touchlight series where it's a solutions journalism focused storytelling, where we don't just focus on what's not working in the concept, but what's working. So we commission story ideas, and that's why this conversation is very important, because we are learning from what's working in other countries. I know majority of us here are Nigerians. There are also others who are not Nigerians. So we are learning. It's like a cross-pollination of ideas. You're learning from what's happening and what's working in other countries. That way you can write a solution story about it, like Shifa rightly said. And people are learning from others. So what's working in this place, if you adapt it to your own context, it can work for you to help improve what we are talking about here today, which is Srhr. So we commission story ideas at Nigeria Health Watch, both solution stories from within Nigeria and outside Nigeria in our Touchlight Africa series. So I'll leave it up to Babatunde to talk about other opportunities and commissioning opportunities that they have with that AJN has and Internews. Thank you very much, everyone.
All right, Chibuke, thank you very much. And again, a big thank you to everybody who's attended this particular session. It's really, really great being here, and it's been an enlightening session. There's been so much to unpack, and I know afterwards we'll get to do a lot of that. So again, my name is Babatunde Okonola. I'm the Internews Health Journalism Network Ambassador here in Nigeria, and it's been great working with Chibuke and the team at the Nigeria Health Watch, and also the team at Internews. So talking about resources, I'm doing this thing where I'm putting up a write-up. I think this should help a lot of people. So I just put up there the Internews resources, which you can look up online. Again, beyond issues of Srhr, you can also check up other resources that can help you as journalists and as media practitioners. And there's also a link there for you to join the Health Journalism Network, where you can receive like a newsletter about, updates about a lot of things there, So can you hear me? Can you hear me now?
Yes.
Yes, we can.
Okay, all right. I saw someone mention something about the audio volume. Okay, I hope it's better now. All right, Dara. So I just put that up in the chat segment. You can look that up. That's how you can access the Health Journalism Network resources, as well as be a member, of the Internews, nothing bulky, straight to the point. It's a resources, practical stuff that you can use. I see a lot of people here who are already members already, and they can also attest to this. Also, there's also one very important part in Nigeria here. Understanding, the underreported journalism and, resources for journalism, especially, more like key interactions and communication. I came up with a team of people, really amazing guys who are working in the Nigerian media space, who approach health either as a main focus or as an intersectional issue occasionally. And so we have a group of journalists, and majorly what we do there is put up opportunities, put up resources, put up opportunities linked into webinars such as this and roundtables such as this. It's not the usual worrisome or bulky, WhatsApp group where you have a whole lot of things happening. It's just focused on health. And in case you need anything as a health journalist, sometimes you have people coming up to say, you know what, I need a contact to this, and someone comes through, for link ups and a lot of things to key sources for interviews, so I also put up a link out just in case you're interested in that. Like Chibuke mentioned, the Nigeria Health Watch is also doing, Nigeria Health Watch is also doing some amazing work, amongst them being the solutions, the solutions journalism part of it, amongst so many other things. So yes, do feel free to reach out. And again, thank you so much to everyone involved here.
Thank you so much, Babatunde, and everyone. This has been really, really impressive session, lots of engagement. I look forward to reading some of the stories or hearing some of the radio programs that come out of this.
Thank you, Beatrice. Thank you, Babatunde, and very importantly, thank you to our wonderful colleagues and participants who have stayed on this really insightful session till now. I know that you are quite the pressure is there for a lot of events, a lot of meetings, but thank you for attending this. And like Beatrice said, we look forward to reading the stories that will come out of this. Thank you to the team, to Chibuke and Babatunde for really developing that systems map. Thank you, Lillian, Abena, and Shifa for giving us very insightful perspectives. And I believe that at the end of this roundtable, we have a lot more of the tools that we need to begin to, or to continue rather, in addition to represent issues and, successes around Srhr in the news more accurately. When we do this, we know that, the media, as Vivian said, the media is the fourth estate of the realm, is more like a gateway. When we get our reportage around Srhr issues right, we believe that that is a very critical node that will begin to shift the landscape for improved SRHR services and uptake across our country, across our countries, across our continents. So to all of our participants, thank you. We are available, we're always available for any other questions. If you have questions that have not been addressed, you can reach out to us and then we send the questions to the relevant expert that you want to speak with and get back to you. So thank you everyone for attending this, and look forward to chatting with you some other time, and look forward to your stories. Have a wonderful rest of the day.
Thank you, everyone. Thanks for the excellent moderation there.
Thanks.
Have a great rest of the week. Bye.
Bye.
Thanks, Shifa.
Oh, Shifa.
Thank you so much.